Last year, South Africa experienced its second wave of surging COVID-19 infections during its festive season. This led to President Cyril Ramaphosa moving the country from Alert Level 1 that had been in place since September to Adjusted Alert Level 3 in December. This included a 10 p.m. curfew, closures of certain beaches and restricted sale of alcohol. Now, almost a year later, the country could be heading for the same fate. Health authorities have even warned of a possible ban on large gatherings. Gauteng is the most affected, with over 80% of the nation's infections.
We are examining the situation. We will make some recommendations in terms of the fact that there is definitely, a spiking of infections. We will make some recommendations in terms of health measures, as already mentioned by other participants in the panel, that we know the measures which have worked, which do work, which is that of reducing crowding, both indoors and outdoors, and continued physical distancing, masks and sanitizing and washing hands, and especially the issue of crowding, especially indoors, but also outdoors in bigger numbers. Clearly, those are the issues which the various structures, including ourselves, as we make recommendations, we will be looking at. It's too early to say what level of reduction in terms of especially gatherings. It will be necessary to take some precautions as to exactly of what nature, to what extent, that is still to be discussed.
The discovery of the new variant, named Omicron by the World Health Organization, has sent panic through the international community. As a result, the United Kingdom, the United States and the European Union have imposed travel bans on South Africa. The department has, however, described the move as premature.
Some of the reaction has actually, been unjustified. I'm referring here specifically to the reaction of countries in Europe, the UK, a number of other countries. I'm told that also a number of European Commission countries are also contemplating similar reaction. All that we did together with our scientists who make this discovery of the variant was basically to be in line with the norms and standards as prescribed by the World Health Organization, that as a world community, as we deal with this pandemic and any other world, the challenges of which any matter which challenges the world health as a whole, rather than just the individual countries. We should act with transparency.
With the recent election season wrapped up, many believe the rallies have had a hand in the surge of new infections. COVID-19 regulations were relaxed, leading to thousands gathering for political party rallies ahead of the November 1st polls. This has prompted the National Coronavirus Command Council to convene. The meeting is likely to see an end to the gatherings of thousands of people. With the youth failing to show up for vaccinations, government is worried over the rising number of new infections. The age group 18 to 34 has taken slowly to the jab. Health authorities are appealing to young people to vaccinate and adhere to COVID-19 precautions. Zolega Kotashe, SABC News, Johannesburg.